So we're going to move now to our first session, our first panel today, our first session today, and it's entitled "The Changing Health Needs of Refugees in Turkey and the Region." And we're hoping that this discussion will allow for presentations around the health needs of displaced Syrians, including, as we talked about yesterday, some of the not commonly recognized health threats, including chronic non-communicable diseases. And we're also hoping that the speakers will also tell us a bit about the health services that are available to the Syrian refugees in Turkey as well. And to, and for us to also learn about what are the needs in terms of training needs and capacity building needs to respond to some of the challenges that will be identified. So we have three speakers this morning, and I'm very happy to introduce our first speaker. And our first speaker is Dr. Fouad, and he's a Syrian physician and general surgeon, and he's currently an assistant research professor in the Faculty of Health Sciences at the American University in Beirut. He moved to Lebanon a couple of years ago, 2 years ago, as a result of the conflict in Syria. While he was in Syria, he was coordinator of NIH-funded study looking at tobacco and public health in Aleppo, where he is from. He's also served as well as director of public health in Aleppo and has a broad experience in a variety of different research areas and has been particularly interested in issues around health system responses. Without further ado, I want to welcome Dr. Fouad. Thank you.
Thank you, Wafa, for introducing me. Good morning. So happy to be here and to share with you some information about the current situation now among Syrian refugees. And I want to thank also Columbia Global Center in Turkey and the Turkish colleagues. I have many friends here. So thank you for welcoming me. As it is a first presentation, so please allow me to present a few slides on the current situation. Actually, I tried, as usual, to use the updated numbers and figures, but you all know that things change rapidly. Sometimes we use estimate numbers because there's no good information system, but interesting, I don't know, sadly to say, that each time I present something new happen. And this time is about this huge influx into Europe. So back to the current situation. As of October 2015, we know that we are now in the middle or maybe a bit more of the conflict after 4.5 years. As Mr. de Mistura mentioned, the UN envoy to the region mentioned that the Syrian conflict is the worst humanitarian crisis since the Second World War, and there's many implications on this issue. Almost 250,000 people die, and this is also a very conservative number, including 12,000 children, and 1 million have been injured. If you look to this chart, you'll see that mainly are civilians, as in all wars. Civilians usually pay the price for, but we can just learn some issues from this chart as collected by the Syrian Observatory for Human Rights. You see that different actors from different parts of the world, including regional and international non-state actors. So 4.2 million refugees as registered by UNHCR. Again, this is the least or the conservative number. 2 million registered by Turkey. I know that some other numbers I've heard yesterday, but I guess all are right. So it's not about number, but we can see that how big numbers are. So almost 7.5 million internally displaced. That means now, because Syria is 21 million in terms of population, that's half of Syrians are now displaced, whether internally, externally in the region, or now far away. Even in the last 2 weeks, I was in Uruguay. I see a group of Syrians 89 Syrians now accepted as refugees in Uruguay. So the end of the world. So in Europe, this year, since the beginning of the crisis, almost 500,000 Syrians now seek asylum, 40% in Germany. During that, unfortunately, 2,600 migrants are known to have died crossing the border. That's in 2015. So we are still in November, in October. So that's a very tragic news. So Syrians tried everything to cross to Europe. Swimming, walking on railways, crossing fences, walking, on foot, but of course they die. 12 million now in Syrians are in humanitarian need. WHO said that at the end of 2015, 90% of Syrians will live in poverty, 60% unable to secure their own food supply, and life expectancy dropped sharply by 13 years. It was like almost 71, now it's 58. There's a little centralized authority now left in Syria, and now Syria are divided into 4 different powers in different settings inside Syria. To give some also update on the neighboring countries, including Lebanon and Jordan, what's new, there's more restriction on movement, but also on the daily life. In Lebanon, for example, in January, announced a restricted 6-month visa. So they have either to leave or to renew it with a new condition. Also, as you know, Lebanon didn't sign the Refugee Convention of 51, so that means they don't have Syrians, they don't have this refugee status, and hence the right and services that link to this. In late 2014, Jordan repealed free health care that was offered to Syrians and start to charge them fees equal to uninsured Jordanian. Finally, at the World Economic Forum, UNHCR mentioned, the head of UNHCR, Mr. Guterres, said that international humanitarian community no longer has the capacity to respond, and, stressed from my side, called for reimagining the humanitarian aid model that's used for decades up till now. What that means actually, that means we need to look into different approach when talking about refugees, displaced, and forced migrant. As Dr. Wafa mentioned yesterday in her presentation, Syria crisis is a model now of what we called it protracted crisis. And also it's a new pattern of crisis. Middle income countries, urban settlements, educated, and previously relatively good education and health indicators. And that's the same in Iraq, in Libya, and now in Syria. Why it's also protracted? Because also it's characterized by what we call it unsolved conflict. And that's the same in the region since half a century, That was in Palestine, Lebanon, Iraq, Syria, and so on. Of course, it's a massive demographic change, militarization and politicization of the healthcare. And we all know about the arresting medical doctors, torture to death, and all that stories about, putting obstacles and offering health services inside Syria. What was the characteristic during that time of the humanitarian response? It was overlapped, fragmented, uncoordinated, unfortunately. Many work on the same issues. And there's short-sighted in terms of the historical conflict and instability in the region. It's they behave as if like it's sometimes a natural disaster more than it's a political war conflict. A lot of opinion, but very few health evidence base. Also, as I said, ignoring the political determinants. What about the intervention? So the limited, actually this sort of mostly programs or intervention shaped to be sort of a quick win, or, jump in and get some, data or, services, and then move to another crisis. There's a limited fund for chronic diseases, and at least I know that in Lebanon, there's nothing for cancer. And of course, another issues like renal disorders and dialysis and so on. Little focus on older age, disabled or psychological illness and trauma over 16 years old. Nothing about prevention, or very limited, but I can say that's not a well-organized program, but nothing about prevention, healthcare among displaced and refugees. I will just mention two surveys, national-wide surveys, that were conducted in Lebanon and Jordan. We were part of the Lebanese one. It's about health access survey. The report was issued in July 2015, and I just want to mention to the main outcomes, especially on the NCDs. So the study examined health status and care-seeking behaviors of Syrian refugees living in host communities. And they took samples from Syrian refugees and host communities. The one in Lebanon, it's almost 1,400 Syrian refugees and 700 Lebanese households. So it's a household survey, not on a, so the numbers are of households. On chronic disease, one of the findings, chronic disease, the presence of hypertension, cardiovascular disease, diabetes, chronic respiratory disease, or arthritis in one or more household members was reported by 50% of Syrian refugee households. So each 50% of households have one or more member that have one of those chronic diseases. Arthritis had the highest overall prevalence, followed by hypertension, chronic respiratory disease, cardiovascular, and diabetes. 70% in Lebanon had an out-of-pocket payment. So that means there is no policy for payment for NCDs. 67% of refugees were currently taking medicine. For those, the rest of 25, 24, not taking, the main barrier was cost. And you'll see this chart that the one of in the above is on Syrian refugees household, and down on comparing with the Lebanese, the hosting communities that living in the same areas, and you see that this almost the same. That means Syrians are, of course, they have the same issues before 2010, but that means it doesn't change, a lot. And comparing with the Lebanese, it's almost the same. And of course, it increased by age. And if you remember yesterday, the slide on Somalis in the United States. So that means people move with with their disease, but also they have also this disease profile of their setting. Same one done year before in Jordan, and the same title with the same aim and target population. So chronic disease, again, the presence of the same diseases in one or more household members was reported by 43%. So it's not that big difference between Lebanon and so it's there 50% here, 43% have one or more members that have one or more of those NCDs list. And the same chart, increased by age, but also with the same group of diseases. To conclude quickly, so during emergency, if we only addressed evacuating people from affected areas or providing shelter, food, and water, or working on injury and infectious disease, what will we do with the ischemic stroke, people with diabetes? For example, in Syria, before crisis, 16% of adults over 20 have diabetes. So people move with their diseases. 48% have hypertension. So what to do with all people that have, those list of diseases that need a special care? So in complex emergency and protracted crisis, it's important to consider NCDs as a priority. Why? Because NCD prevalence increasing worldwide. Countries in Middle East and Turkey are facing epidemiological transition in morbidity from infectious disease into chronic diseases. Poor shelter, inadequate sanitation added more to these causes. And the main problem is what to do with the national system versus the system on refugee healthcare system, including talking about fund, human resources, infrastructure, stewardship, and etc. But the main question is, what's the key to resolve Syrian refugee health crisis? I think the simple question is to end this war. Thank you very much.